Tim, bring us back up, if you would, please.
They get mad at us.
Yeah, sorry, Nancy.
And then we'll go ahead and have you announce yourself on the record. So.
Okay. Ready? Brad Ritchie with the Idaho Office of Emergency Management.
Thank you. Darren Letzering, Idaho Office of Emergency Management.
Well, good morning.
Good morning.
Thanks a bunch. Lots of changes since the last time we had the opportunity to talk in Boise for the Preparedness Conference. So just want to congratulate you on your selection as your new emergency manager and the location of where new emergency manager resides. Wes is an incredible partner. As a matter of fact, I think when he was looking to come down here, I was trying to steal him away and bring him to the States. So you all did very well.
Well, we appreciate him.
Yeah, he's an incredible person and does a great job. So you've done extremely well. A couple of things I just wanted to talk about, and most of it will kind of come up in conversation, is the Preparedness Conference we were going to do this year. I was really excited about it because Brock Long, the FEMA administrator, 2 administrators ago, made some pretty heavy-duty legislation changes on how mitigation's divided up and how it's carved out of the disaster account ahead of time. So last year in October, they released $500 million for mitigation money. This year, of that $500 million, 350 billion projects were identified money-wise for that 500 million. So needless to say, it didn't go as far as they initially thought. So this year they bumped it up to 1 billion. And I think just to kind of appease people, because that 500 million only went to 10 states, they released another 3.5 billion, and they divided that up amongst the states based on the 2020 response to COVID. So the state of Idaho received 11.4 million. So that's available to us right now. Now there are some strings attached to it, but going back to Brock's vision for this money was understanding that the nation can't continue to pay for disasters the way they pay for the state disasters year after year after year. So what can we do to reduce the cost? And that's where he said, if you set aside 6% of the previous year's disaster, push it out towards mitigation so communities can evaluate where they are, where they want to be, and how we can reduce the risk in those communities. That's what it's designed for. And when I say there's some strings attached, you have to kind of tie it to how the climate's changed in your area. You know, when you start talking about drought, when you start talking about wildfires, you start talking about flooding, you start talking about a lot of things, water, wastewater, communications, all those different things. What can you do to improve your community 10 to 20 years down the road? And I know that's kind of a big, wide open thought process, but that's what it's really designed to do, is be kind of one of those mind stimulating, okay, what are the issues we're fighting today? Are they a risk? You know, and will they continue to be a risk? And then if that's the case, let's do some things to help reduce that risk so that you can continue to grow and do things, but the risk may not go away completely, but it may not have the impact that it was having, you know, before you mitigate it. So those are some of the things that BRIC can do for you. It's called Building Resilient Infrastructure in Communities. So when you think about like a microgrid, and again, what does a microgrid look like? I can't really tell you that. I can't give you all the details on what it looks like, but I can tell you those are some of the examples that are allocated for projects associated with being more resilient in your community. So there's a couple things you can do. Last year they had the ability to apply for technical assistance. They took 10 projects technically, and helped that community determine what it is that may be good for the community. If you had no idea that's where you would apply for technical assistance. It's free. They come in and say, hey, this is what I would do. But again, when we start talking about all of it, it's all competitive nationwide. So I can't promise you that if we put in a request for free technical assistance, that would be the case. The other one is a progressive grant, and that's where if you had an idea what that project looked like, but you don't have the engineering study and you don't have the technical expertise to put it together, then you could put in for that grant funding that will help you over a period of time develop the project so it would be potentially competitive down the road. You'd have a shelf-ready project you could submit year after year if it didn't get approved the first couple times. Where's it all gonna go? I can't tell you how long the money will last, but the disasters don't seem to be slowing down anytime soon. So I hope that we're able to continue to look and evaluate. I know California put in for a grant. They were approved under that $500 million on reducing wildfires in the urban interface areas, if you will, out there. What that project looks like, I have no idea. I'll just tell you, wildfire has picked up a lot of interest over the last couple years. And wildfire, we have the emergency manager in Oregon testifying to Congress this week about wildfires and the inequities that happen between a hurricane response and a wildfire response. You know, if you look 96 hours out, FEMA's starting to push trucks and trailers and everything ready to go when that hurricane comes in. In the West, we know that NIFC, Department of Interior and Department of Ag, doesn't have the resources, and they're trying to divide up what they have to go across the entire West out there. You can't get a grant ahead of time. You can't position any equipment or resources ahead of time. And we have the technology to say, in 3 days, this fire is going to be here. But again, we're not treated the same way as hurricane states. So right now, that's a big push. And I know that's a priority for the Western Governors Association and a lot of the Western states that may or may not be in the Western Governors Association, is push for the equity in wildfires. Where's that going to go? I can't tell you where it's going to go, but I will just tell you that the FEMA administrator, first FEMA administrator ever to come to Idaho, she came back in July, spent an entire day out at NIFC to see how they do things and work through things. She's got a previous background in as a fire chief in Colorado before she took a job at FEMA, which led to her past position, which was the New York City emergency manager. And now she's running FEMA. So she understands some of the things in the West. She understands rural communities and the challenges of that, which is a great thing for us. She understands the fire and the fire issues. Like Darren and I have talked about, you know, fires are tough because it's dependent upon you, not the state or not the federal government, to deal with wildfires. You know, your mutual aid with other counties and other fire departments is what's going to put the fire out. There's nothing I can do other than say, we'll cost share this with you, or we'll get a grant from FEMA to pay for all that support, or 75% of that support. But I can't get you any more resources. There's no other resources out there normally when one of those fires kicks off. So wildfire hopefully will be changing in the near future, you know, and help us out.
A week ago, we was down in NACO, down in Salt Lake, and that was, I don't know, 50% of the conversation.
Fires.
Awesome. That's a good thing. It's a good thing for the West.
Well, and I think a lot of it in the fire, it's not just the response, but it's the understanding of what we're fighting, when we're fighting, how we're fighting, what are we doing. You know, there was, I read an interesting article that was talking about one fire that was burning that had no chance of an urban interface. They put all their resources to it. And then the fire that was burning next to the urban interface, they didn't do it because it was a different agency of a different thing. And so everything went to this one first, but then they didn't pull it off and go fight the fire, and they lost like 150 houses. And it was like, that's, again, how do we implement, you know, in an operational standpoint, how do we determine what is the most
Right.
prevalent? What is,
Right.
you know, and it's one of those conversations because everybody thinks it's their most important thing. But how do we prioritize that? How do we have
Right.
those conversations to get, hey, sorry, I know this is a big, huge, raging fire, but we have one that's going to burn down an entire town. We need to move something, or we need to do something.
You know, you mentioned that. It was funny sitting there that day in Nipsey with the administrator. I will tell you, it was kind of eye-opening because they could care less about where the fire is or who it's touching or what state it's in or what county. All they know is here's the limited resources we have and we're going to put them right here. And you want to say, well, yeah, but there's one right over here, Dixie, up in Valley County. Can we get something up there? They don't even talk about that.
Wow.
They look at, okay, we're going to move these resources down to the Great Basin or the Northern Rockies. They talk big picture on how they do it. The other thing that's, you know, the emergency managers in California, Washington, and Oregon, Idaho, Montana, Wyoming, and a little bit from Utah would tell you that wildfires are only one thing we deal with from the federal land that we have because we know the landslides, the rock slides, the mudslides are going to take out your infrastructure. So it starts on federal land, they don't manage it, which is what caused the fire, and then after that they don't reseed it or replant it, which generates the rain, the snow, and the next thing you know is you're trying to rebuild a primary road to a community because it washed out. So we talk about, and we've talked about this, the impact it has on the local communities is significant because of poor land management. I don't know where we're going to go, but if it's a topic that happened last week, 2 weeks ago, the emergency managers were together. First time we've really taken wildfire seriously since I've been in the position. So I'm just hoping that there's a lot of good things that will come out of the momentum we have right now. So, yes, sir.
Quick question. Have you ever seen any statistics or costs on the seasonal cost of hurricanes versus fires? Because as you were talking about the federal disproportionate response,
Right.
what is the impact of hurricane season versus fire season? Have you seen anything like that?
I can look at individual states. Again, that's the only way you're going to ever find out about fires. You know, like this last year, Idaho will spend $65 million on wildfire. I can't tell you what Oregon is or what Washington is, but I can look back in and I can see what FEMA has approved in Louisiana. I will tell you, if you look at Katrina, back in 2005, they're still paying millions and millions of dollars to Katrina now to rebuild the levees and rebuild the communities that happened during that hurricane. So anytime you have, when you start looking at some of the disasters we've had in Idaho, if you look from $5 to $8 million, that's typically about the cost that FEMA has paid out over Idaho. And that will take about 5 years, 5 to 8 years to finally close everything out. We just closed the 2015 grant, a 2016 grant, and because don't just look at the response, then you've got to look at the recovery and the rebuilding. And then there's mitigation money that goes along with that, and mitigation can't happen until after everything is put back and you're starting to look at how can you do things better. Some of it can start right away, but most of it starts happening after the recovery has already gone through. So, and mitigation projects are burdensome, they're challenging, take a lot of effort to make that happen.
Well, the other thing
yeah.
too is like in the hurricanes, you can see a direct response or a direct impact to your economy. Okay, hurricane comes in and we see this community that has the immediate, okay, so this, but what they don't track in the fire side is, yeah, okay, we spend $65 million fighting the fire and dealing
Right.
with all this other stuff, but then they don't talk about exactly what you said, reseeding, mitigation, the lost timber that will not be harvested, the tourism dollars that will not be recouped, and all those secondary and tertiary effects, those
Yeah.
are never brought in, and they don't take fire in the same aspect of hurricane is a single point event. Okay, this event did all this to the economy and all this bad stuff happened, but they don't take all of these fires from across the West. They don't actually take them into a single response that year and say, this is what it did to your economy. This is what it did just in the fire season up here. The smoke that we were getting from California, we don't even have it, and we're canceling events and all this other stuff because none of that gets put in there as well. And that's the problem, is changing that mindset. Is a single point event in a hurricane, a single point event in the wildfire is the season. And they don't look at that, and they won't track it that way, because if they looked at it, I'm afraid that the numbers would scare them very badly.
Yeah. Hopefully we'll get some traction to change that. And, you know, so mitigation money could be one way that we can start rebuilding a few things or doing some things different. I can't promise you everything, but I can tell you, if you look at water, wastewater, microgrids, you know, that way you're a little more resilient, as well as communication capabilities. Those are some of the big example areas that they do. And there's been several counties that have had significant water issues this year. So understanding how we can deal with them now, but more importantly, everybody sees the growth that we've been experiencing over the last couple of years. How are we going to expand that if the growth continues for the next 10 years? So those are just some things to consider. There is money available. Like I say, there's $13.4 million available. We'll have the $1 billion is open for applications, but again, you're competing with the LAs, you're competing with the Seattles and the Portlands and the Salt Lakes and so on. That's why you can see that only 10 states got the $500 million.
That's why we got the expert.
Yeah.
Well, one question with this is, as we went through and we made that position full time, and Darren, we've had this conversation, is looking at this as more of a regional approach. Is we're setting up our C2 node, command and control for our operations centers, and what we're trying to do to help flex out, to help train other counties and stuff around us. And so that's kind of been the push right now, is how do we stand up that C2 node, and that's going to lead into some discussions probably on our next stop and tour, is what we're looking to do there. Is those funds available to help continue doing stuff like that? Because we're trying to do something I think it's probably a little groundbreaking down here.
Yeah.
And really, as I equate it to, it would be like getting a computer software degree, but your campus is Microsoft. And so what we're looking at doing is embedding WES in ISU's response efforts and what they're looking at doing. So if we actually stand up our EOC, the people that are there going to school are actually going to be in the EOC and actually see how this works and turn people out that have actually been doing it.
Yeah.
So.
And see, I would tell you, if you look at Texas as a model, Texas would be a great one to take a look at, because Texas Emergency Management is within Texas A&M now.
Mm-hmm.
So they take all the students that come through Texas A&M, run those through emergency management courses, bring them on. Even a veterinarian has to go out to rural communities after a flood or whatever to learn the vaccination process or whatever kind of health care the animals may take in an impacted area, so they know what to deal with when they go back and they practice in another area. So Texas A&M has really got some great momentum going. So having a partner like ISU is an incredible opportunity for you to partner, because you got a lot of students and you can assign a lot of students, especially grad students, people going through. If ISU is going to support you, do some great things, and mitigation projects would be one of the areas that you could really lean on them to help you take a look at the risk, be more resilient in those areas, and not just your county, but the surrounding counties like you're talking about regionally.
I don't know if you've been down to DRC before this tour that's going to happen here in a little bit, but when I went down there, I got a little excited. My Army officer came out, and I got a little excited on okay, now we're actually talking, and they are. I think copying a little bit of Texas A&M there, and I think it would be something that, as we talk about this is something that could be a huge benefit to the state, not just our region. But this was pretty cool, and so like for us, and it's another discussion, but some of our ARPA funds and stuff like that, there may be a recommendation coming forward to the board to help fund and start setting up some of that stuff.
Good.
Because it's you're talking direct emergency health related, this is what we want to have. And so that's, I think, the discussion that we will probably end up having with ISU, with the state, because I would really love to see this be not only an operational model, but a learning model and something that we can actually flex out there and say, hey, this is the example that you want to build.
Yeah, right.
So,
It'd be nice.
You
Yeah,
know,
I'll just tell you.
one of the things that's, that we talk about it, and we talk about it, but we never act on it, is if we continue to do what we're doing, we're gonna continue to get what we've got.
Yeah.
And so the things that we're trying to do here within Bannock County is a springboard approach in changing the concepts for emergency management from a defensive mode to an offensive mode. We wanna take the fight to the fight.
Yeah.
And so there's a lot of the things that we can do, knowing that we're short on manpower, but we have technology available. We're putting the cameras up on the communication towers and relays,
Yeah.
so we can spot and monitor for smoke. We can pan, we can zoom, and it's a full application for other response protocols. That's an earlier, more warning system instead of sitting back
And waiting.
and waiting for somebody
Yeah.
to call it in. So we can do that, and we're doing a lot more in the monitoring aspect, because there's this philosophy out there that we don't activate our EOCs until we have an emergency declaration. That's
Yeah.
wrong. We want to get that think tank in place to contain, control, and mitigate the situation as soon as possible, and it's those resources that's going to help us move forward. So that's some of the things we're kind of working for, and these
Well-
commissioners have been great to support that, as well as a lot of the public safety departments within.
not only just Wes's attitude towards it, but getting the other counties on board. Our 911, you know, that department has taken a 360. I mean, that 180, excuse me, come all the way around back to, you know, they're fully up and functioning. There was a discussion that they needed an item bought, and it was the first time I saw every chief of police and every fire chief that's in that district actually show up and understand what was going on, the equipment that was being purchased, how it was being integrated, communications capabilities, and kind of as Wes said, yeah, it's went from fighting from the defense to fighting from the offense, and having audacity on your side to let's go get this done. Even though people sometimes think, why are you doing that? There's not an emergency here, but I would love to see this in the next 10 years. That I think we'll be very pleased where we're at.
Well, and I think you as commissioners, I have to commend you for looking at the 911 fee, because I think you all have approved the adoption of the additional fee,
Mm-hmm.
which allows you, instead of buying that equipment, to apply for a grant through the PSCC to come out and buy that for you.
Yeah.
And especially if you start looking at, if you look up to Idaho Falls, they've done some pretty incredible things to bring other counties in. So if you tie it in, if you take the opportunity to tie in the counties you're talking about here in Digby 5 and bringing them together, you will start receiving a lot of grants to be able to do that.
Yeah.
You know, that's one of the things that has frustrated me is, you know, when people look at response, they evaluate how you responded to a disaster. What they don't look at is all the effort you put in to be able to respond, but all the back end stuff that you're doing to get the projects closed out and then mitigation out there to do that. Because with every disaster, there's 10% mitigation funds that come back into the state. And there's a lot of counties that have never used mitigation funds. So I will just tell you, they don't know what they're missing out on because they've never applied for them. People will apply for them to build a plan and have a mitigation plan, but they never look at what they have in the plan to try to mitigate
Yeah.
and to reduce the risk.
Bannock County was there.
Yeah.
That's where we've been.
Yeah.
And we're grateful to see a little bit of sunlight and want to come out
Yeah.
and do the right thing.
That's awesome.
The right people in the right place. It's
Yeah.
taking a little bit of time, but we're getting there.
Yeah, there's one thing about it is emergency management is not a fast, responsive cultural change. It takes time and it takes buy-in, and it takes new people like yourselves to be able to see what the future looks like and be able to plan ahead and do that. So I commend you for that. Again, I commend you based on hiring the people and having the vision that you have today, because you would be surprised out there how many counties don't.
Yeah.
So the BRIC program, I'm hoping to have Brock Long, that administrator that was instrumental in getting this set up for everybody, at the winter Idaho Association of County Commission meeting in February.
Good.
So think about the questions, think about it as an opportunity to talk to him to figure out, what his vision was and what he thinks. And he's a great presenter, great visionary person. Got a lot of respect for Brock and all the things he's done. The other thing is next June, we're going to do Cascadia Rising exercise again. We did one back in 2016. Cascadia Rising is British Columbia, Washington, Oregon, Northern California. There's a subduction zone off the coast. When you start looking at looking at historically, every 300 years it's gone off, 9.0, shaking for over 30 minutes, with all the follow-on after that. And then after that kind of settles down, then the tsunami that will create coming inland. So if you look at where Seattle is and you draw a straight line down about the Portland airport all the way down into California, everything west of there is going to have an impact. The ability to move stuff out of the ports won't happen out of Oregon or Washington, and anything in Northern California. So then the supply chain gets disrupted. But more importantly, there's hundreds of thousands of people, millions of people that'll be in that impacted area that will need help. Oregon and Washington can handle about 25,000 with food, water, and sheltering initially, but that leaves 1.1 million people that won't have any kind of food, water, or shelter. So Idaho, as a supporting and surrounding neighbor, what can we do to help? How can we coordinate? How can we get food, water, shelter to those that need it? How can we coordinate the effort going on in the response to the impacted area? Without SeaTac, without Portland's airport, then you've got Spokane and Boise as major airports that would be available for FEMA and other federal agencies coming in and trying to get into that area. Whether it's trucked over or flown over via helicopter is yet to be kind of determined. But how would we coordinate that effort? If they're coming in here, it's going to have an impact on Boise. It's going to have an impact on what we do. They don't have the staff to be able to sit there and work with Oregon to say, hey, don't send us any water. We got all the water we need. We need more blankets. We need more shelters. We need more cots. Get those things ready and prioritize them.
So is this like doing a warfighter exercise? Is
Kind
this
of.
what you're doing?
Yeah, absolutely. Yeah.
So is Colonel Smith still the
No,
FEMA rep,
he-
or did he move on?
He moved on. He retired about 2 or 3 years ago, right about at the conference time.
Okay, so there's that Colonel Smith, and then there's Ryan Smith, the younger guy, just got promoted to full bird. He was the FEMA rep for Corps of Engineers and a bunch of others that had the state of Idaho. He tried to get me to go be on his staff. And
Yeah.
And I think and he was one of the juniors, so there's the two Smiths, Smith and Smith.
Yeah, right.
And
Yeah.
so I remember him talking about this, and it sounded like a pretty intense exercise to be able to.
It was pretty intense when we did it in 2016. There were a lot of people that were unhappy. Well, when you start looking at the complexity and you look at your plan, all of a sudden you're not on your plan anymore, because just like the things we've been dealing with for the last 20 months, those weren't written in the plan either. So you got to be able to flex. You got to be able to understand when to flex. And if you're getting really territorial over a certain portion of the plan, then you might as well get over emergency management, because there's always shades of gray in which you're going to have to work in, because it's not always black and white. And the last 20 months it proved that to be a fact.
So for that exercise, will it go down just to the state level, or are you going to take it down to the county levels as well, or?
We had tried to set up a lot of effort at the county level, but having gone through what we've gone through over the past 20 months, there's not a lot of desire to jump back in and take some free time off in the summertime and do an exercise. So a lot of it will happen at the state level, but there's still counties and there's still coordination that'll go on at the county levels as well. So this would be a good time to have your regional coordination up and going, because I know some of the counties we visited yesterday probably won't want to participate in that. But like I mentioned to them, you know, when we look back at 2005, 200 people from Katrina that were impacted by Katrina came to Idaho. That's the movement of people that migrate out or somewhat kind of forced to migrate out because there's not enough housing solution in the local areas. So what is it that Bannock County or Franklin County could do to house people? We saw a little bit of that during COVID when people from Oregon and Washington left the state and came over and started visiting the state parks, any park they could, or any place they could park a trailer, and do a lot of things in Idaho that normally they would have never came over here. But based on what restrictions they had in the state, they came over here and did that. It was a huge impact on Idaho. The economy was great in certain areas, but the impact and the supply chain wasn't prepared for that kind of migration as well. So we know what it's going to be. We know that there'll be some that come out, and we know the big push is going to happen, you know, 3 months later when when you can't get a shower for so many times, you can't get things gassed up. People are going to start moving out. Even though they loved the place they grew up in and went to school and worked in, they're going to move if the services aren't provided to them in a certain amount of time. So what healthcare system is there here? You know, what is it that Wes could let us know that, you know, we could take on 200 people or 300 people. We have this capability. Those would be the coordination efforts that we'd look to try to do with the local communities and just kind of go back and forth on how we could do it. 2014, there was an exercise up in Alaska that been multiple exercises up there, but in 2014 I went up there and watched. They had a C-130, the veterans home, of course, was running on emergency power, so they were trying to move all the veterans out of the Anchorage VA home. So they reached out in the region, or regionally, and said, hey, who can take on some VA patients? So Idaho had the capacity to bring on 34. So they loaded up a C-130, put a bunch of mannequins on board, and flew them to Boise, Idaho. We received them, processed them, transported them down to the VA, who did the same thing. That's the kind of level of exercise this is. Normally, there's no funding holdback. If you're going to be able to do it, let's see how you can do it. I can't say that we're there this time around. It was planned to be that, but it's just been a real challenge to get people to start planning. So that's been a challenge. So it may be a lot of, and I know it's going to be a lot of tabletops. So it's going to be a lot of, hey, what can we do? What can we get Bannock County to do? How do we report? How do we provide the information? How do we do certain things during that exercise? But I invite you to come to Boise to see what it is. I invite you to come up and see the EOC.
Yeah.
Because COVID taught us 1,000 lessons, if you will. You know, in the first part of COVID, I would tell you what was a best practice today was old news and something we were looking to improve a week later. You just couldn't keep up with best practices because things were dynamic, things were changing so much. So you can't bring people together because we can communicate, we can solve problems in this room today. But if I was on a VTC, would we have the same interaction? Will we have the same problem-solving capability that we would in a big area that's spread out big enough to be able to house and still provide separation of folks and be able to communicate and talk and solve the issues that are out there? So our CO2 alarms kept going off because we had too many people. There wasn't enough recirculation in our EOC. So we fixed a lot of that. So we've got a, you know, it's still not ready yet, but we're still working through the process to try to do things better. So I invite you to come up, take a look, see. That way maybe there's some ideas we can get from you and some ideas that you could get from us. So that's what it's really all about. So you'll get that opportunity next year. I think it's, like I say, I think it's like the 18th, 19th of June next year.
Cool.
We'll take advantage.
And we will normally, you know, we'll still plan to have the Preparedness Conference, but we may do some preparedness stuff right along with that exercise to be able to, if we can get everybody to come in and take a look, then there may be some opportunities to talk about some things. The only other thing I had is with the disasters we've had with FEMA since 2017, 19, and again 20, 21, working with them on multiple different things. The FEMA regional administrator was here, and he spent 2 days up in northern Idaho visiting with the commissioners as we went through and looked at what the windstorm did and how FEMA's response was to that windstorm up there in January. The other person that went was a policy advisor from the governor's office. So unfortunately, they're not here with me because they're not able to travel around the state like I can do. But I would offer you the same feedback that we offer to them, and that is there something that IOEM could do different? Is there something that you've seen over the last 20 plus months that the governor could do or change? And is there something based on your all's relationship with FEMA that you would have me take back and give those entities as well as our office?
I would defer to Wes.
Yeah.
Wes is our subject matter expert.
You know, for the most part, I'm gonna say no. I think the coordination, a lot of the integration and the frequent phone calls, because I get the call from FEMA Region 10
Yeah.
monthly for a status update and find out what's going on, if there's anything that needs to be done. I think that role works well from the state perspective. If we take it back 20 months to the kickoff of COVID, and when we started ramping up for our EOC and the communities at large and providing that support to the communities, that should have been our main focus. And when we stood up the EOC, it was established as a situational EOC. We had about 92 individuals in there with the primary focus on the PPE issues and trying to understand what COVID actually is.
Yeah.
And the consequences, the impacts, and who's actually at risk. We developed a lot of surge capacity, a lot of planning and effort went into supporting the community at large. And then after several months, it kind of evolved into a departmental EOC in which the Public Health Department took over, and our Department of Health and Welfare was the oversight agency, and we deviated from the community response to a state oversight, and that impacted a lot of the communities across the board. And from a community perspective, we didn't have a voice.
Right.
And because of that, the impacts to the communities at large were devastating. Right now I'm working on the Regional Economic Resiliency Team, which is a recovery group to come back in to provide financial assistance and trying to take a look at what we can do to bring the economy back to where it needs to be. Normally, a lot of those recovery operations should have been through the EOC operations and considerations for the community needs at large, instead of an operation that goes on behind closed doors later on after the fact.
Yeah.
And I think the biggest the dialogue and that communication from the state and the elected officials needs to be expanded so that small jurisdictions have that authority to implement the protocols and protective actions and the things they need to do to protect the community at large, as well as taking into consideration all aspects of the incident.
Yeah.
And I think that was, it didn't roll out that way.
You're right.
And the one thing that I would probably add on that is that we've gotten started, is as the plans go, and we all know that you have the best plan in the world, and it usually goes out the window in about 10 seconds, then plan B usually is about 30 seconds later.
Yeah.
And as you said, sir, it was, if you get protective of a plan and you're not there, and kind of my two pieces on that would be, step 8 of troop leading procedures is observe and make changes as necessary.
Yeah.
And I think there's a lot of that we've had some people that have kind of dug their feet in places, and they just, you have to be able to observe and make changes as necessary. That would be probably my first thing,
Yeah.
is that we probably should reiterate that. The other thing is end state. And this is the biggest problem, is people can do amazing things if they have some idea where the end zone is and what the end state is. What are we fighting for?
Right.
And that's something that we've missed here. We, in Katrina, it's, hey, we're going to save the 9th Ward, we're going to get the water out, we're going to get the people there. Hey, it's a
Yep.
forest fire, we're going to get this fire out, we're going to do this. And in this aspect, there is no end state. Well, end state was crush the curve for 15 days and let's get this over and let's do this. Well, then that goal line changed again, but it wasn't clearly defined. Well, now we're talking about vaccinations and we're talking about all this stuff, but what is the clear end state? When is the emergency come out of end state? When have we succeeded? When is it over that we could wave the flag and have a hoorah party at the end? And right now, okay, we have X amount vaccinated, we have this, we have that. What is that end state then? Where this goes back from a reduction of emergency to daily operations. And that, I think, has been the biggest key that I've gotten in feedback from myself, is people are willing to do great and amazing things, but a little bit of that what is your mission, what is that task to subordinates to understand what is going on and what we're trying to accomplish. That has been the lacking part, and it's not coming out of your office, but there is that overall end state of, and that would be something to drive to the governor's office of what is
Okay.
end state.
No, I totally understand everything that you both just said.
I was trying to be as
No,
politically polite as possible.
I fully, and that's the one thing that, at times can be a little bit frustrating, is because you know how the state is supposed to respond. But if the state doesn't respond that way and you change it, then you've changed it. And then all of a sudden, people that have never been in charge before or never done things before are the ones in charge.
Yeah.
So you can either fight it, or you can kind of go with it and see where you can help. And that's where communication, I get frustrated with communication, because the more I learn about communication, the more I know I'm not a good communicator. I can't keep up on social media. I can't do the text. I can't keep up with everything and still be here today talking to you.
Yeah.
And then people get really hung up on a single word. So communication is a real challenge. And you may say something that somebody is offended by, but it was a word that they picked up and took a different way. Because a lot of times what you hear isn't what I said, or the inflection wasn't there. So a text or an email can really get you going down the wrong path. But I will tell you, we don't do a very good job of communication. And I have struggled with the lack of communication. Because, again, not being the lead agency on COVID, it's a real challenge to tell somebody else. But your voices have been heard. I will tell you, there was a health district just recently that went to the governor and said, hey, look, your communication is bad. You're not communicating. The communities are not able to be informed. We don't know where we're going. We don't know how to get there, but we know how to respond to the communities. That has kind of shaken up a little bit. That was a good thing that was a great letter received. But again, I will just tell you, is how do you change it now? How do you change it 20 months into it? So we're still kind of working through some issues to try to get there, but I will just tell you, I understand, I fully understand, and know where you're coming from on that.
Well, like I said, it's a lot of it, people can do great things.
Yeah.
And a lot of it, that communication factor is up and down.
Yeah.
What are we flexing? What are we doing? Have we heard what's going on the ground? Over on this side of the state, we're hearing that people are dying in the streets in Boise, and we've got bodies piling up because that's what's being portrayed in the news.
Right.
And over here, we're looking at it, and we're looking at our hospital data, and I'm going, we've got 4 people in the ICU with COVID on ventilators in Bannock County.
Yeah.
And I have diversion in the ICU, not because there's not patients, it's because they don't want to hire the staff to come in and do that. And we can see it in the report that we get once a week. And that's kind of the problem that I have, is we have to be careful in that communication aspect of, we might have a very serious issue over here, but it's leading people to believe that this is make-believe over here because we're not quantifying what we're telling people.
Yeah.
We got the houses burning in Boise, man, and the weather's great in Pocatello, but you still need to be careful of wildfire
Yeah.
out here. And that's kind of that
Yeah.
whole, that was the big
And
feedback
it
that we got.
happens in every disaster.
Yep.
And you said it. If the wrong people end up being in the leadership role,
Trouble.
you're in trouble because they've never been there before.
Right.
And once they are given that authority, then it's almost impossible to get it back.
Yeah, once you let the horses out, it's tough to get them back in the corral.
So,
Well, they're making decisions based off of
Unless you
emotion.
got along the rope, a couple good dogs.
that's why we got the expert here, buddy.
And it's the decision by emotion, it's the decision by fact in quantitative and qualitative
Yep.
analysis.
Yep.
And that's been the real problem in a lot of this, is you have, people have never been trained for it, and when making those decisions, it's daunting, and we've seen some people that have maybe cracked and had some issues, and it's been
Well-
hard to help them that way.
Yeah, and I will say, how many months have we been into this and we're still struggling with the data and what the data is really telling you and what the data is not telling you. So it
Exactly.
goes back to, if you're gonna communicate and that's putting up or putting out numbers, then you better know what the numbers really mean. And don't say that, these numbers may fluctuate because we're behind in testing or, that means nothing. That's just an excuse of saying these numbers probably aren't correct, but it's the best we've got.
And more money's not always the cure.
Yes, you're right.
I would love to have a lot of them have to brief a lot more colonels and sergeants majors, because I think they'd have their briefing tied up a little bit tighter
Yeah.
and a little bit ready to go if they
Yeah.
knew the bus was coming over the
Yeah.
top of them.
And I don't need a whole bunch of updates. Give me updates every 2 weeks. Show me what you're doing in between.
Yeah.
To make a difference.
I agree with you.
Now-
Anyway, we appreciate you coming down.
Yes.
And we appreciate the relationship that we're developing. And like I say, we don't want Bannock County to be the example on the bad side. We want Bannock County to be the example on the positive side, and we're gonna work hard.
Okay.
And with your help and we know with Wes, we're gonna be there.
Okay. We're gonna do everything we can help you. We're gonna do everything we can to help you get where you wanna be.
Oh, that's it.
Thing.
Let's go on a tour. Look.
Yeah, okay. Well, thanks a bunch. Wes.
I'll meet you there.
Did you wanna come on?
You know the old National Guard Armory?
That's right.
Okay. So with that being said, we'll be at recess until